Dr. Mohit Bhandari. I come from Indore, and we run a bariatric and metabolic center here at Indore. I'm primarily a laparoscopic bariatric and metabolic surgeon and also trained for doing robotic surgeries. So India at this point of time is around 3% of obesity. That's the incidence, and that 3% is an average incidence. It's higher in states like Punjab, Haryana, Gujarat, and Maharashtra, and some southern states like Tamil Nadu. But overall, the incidence would range between 3% at some places to 5% at others, and to 8 and 10. But the average percentage of Indian population is 3% obese. Out of these 3%, almost 60 to 70% of obese are diabetics. And that's a very bad situation here in this country, because we get diabetes in India at a very lower BMI, the average between 27 to 30. So that's why our population, which is obese, almost all of them, or maybe 80% of them, are turning out to be diabetic. The major cause of obesity has been a sudden change in lifestyle. So as you can see that we are following the trends in Europe and US, and the same trends being followed here. The lifestyle has completely changed. It's more shifting on digital platforms where we sit and talk. Less of physical activity, very available resources where there is abundance of things where you can order and eat. There are abundance of people who can help you out with things which you're doing previously yourself. So I think it's both the easy availability of food and lack of physical activity, and a sudden change in lifestyle where we are more shifting towards digital, less of physical labor, which has caused the sudden rise in obesity in India. We have a certain kind of liver here in Asia Pacific region where the deposition of fat on the liver specifically and the mesentery of our bowel is pretty fast, and that's why we have more amount of diabetes, and that diabetes even comes with little fat deposition, because the fat deposition in India is specifically on the liver and the visceral organs of the body, and it is that fat which causes severe diabetes. So we have patients at the BMI of 27, little bit of overweight, but they will have diabetes. If we compare this with the Europeans or the Caucasians, they have diabetes which peaks at a BMI of around 40. That's a very big difference. So that's why we get early diabetes, because in short we can say that our visceral organs like liver, bowel, mesentery, kidneys, and other internal organs, the deposition of fat on these organs comes with a very little gain of weight in India. We have more visceral fat than the subcutaneous fat. I would say that bariatric surgery is an effective measure to manage both obesity and type 2 diabetes. It's a very complex question, but the simple answer is that it's the most effective modality available on earth to treat morbid obesity and type 2 diabetes as of now. There is nothing as strong as bariatric surgery. Having said that, it is not, the message is not that everybody is a candidate for surgery. The message is that we need a multimodality approach here, where we have or maybe we call it as a multidisciplinary approach, where we start with basic lifestyle modification, and then we go on to the drugs. And if the drugs and the medical management do not work, we go for the endoscopic measures to manage the weight and diabetes. And if finally that also does not work, we go for surgery. So it's a staged approach, it's a multidisciplinary approach, it's a multi-modality approach. But yes, out of all the stages of treatment I've mentioned in this entire answer, bariatric surgery remains the strongest available tool on earth to treat morbid obesity. There's a lot of data to support what I'm saying. If we choose the correct kind of patient, which means that patient has a good insulin reserve, and he is a type 2 diabetic, these patients, they can completely go off their diabetic medications after bariatric surgery. Almost 95% of them would go off medication like insulin or oral hypoglycemic agent within 48 hours after the gastric bypass operation. Remaining 2 to 3% will gain good control of diabetes and will go off medication in another month's time. And that's very important to understand, that we are not only dealing with obesity here, but we are dealing with type 2 diabetes. And what I want to tell the patients, that the mechanism of bariatric surgery, when we specifically used to treat it for diabetes, is by weight independent mechanisms. So these are not weight dependent mechanisms, which means that even if you treat somebody with a normal BMI by metabolic surgery, they get good resolution of their diabetes. In India now, with the insurance coming in for bariatric surgery, we should have patients coming to us pretty early. The policy I always call it as nipping them early in the bud, because once they come to us and they have exhausted all their pancreatic reserve, it's very difficult to treat them of diabetes and even obesity. So the earlier you are, the better are your chances of getting a resolution. One should seek help of an expert, maybe a bariatrician or a metabolic physician or a surgeon, when he goes above a BMI of 28 in India, because somebody above a BMI of 28, if does not seek help, the chances that he'll go to a BMI above 35 within 5 years is almost 90%. And again, there is data to back what I said. So anybody above a BMI of 28, go to a very good expert metabolic physician who understands the disease, who also understands the fact that it's totally different ball game with India and Asia, where even a BMI of 28 can cause severe diabetes because of that little amount of fat deposition. It's time to act, and everybody should act. इसका रीजन ये है कि जिस भी घर परिवार में यदि कोई भी पेशेंट या कोई उनका घर का परिवार का मेंबर यदि ओबेसिटी और डायबिटीज से सफर कर रहा है, तो उसको पर्सनल फेलियर या एक डिसऑर्डर इन पर्सनालिटी या फिर कम एक्सरसाइज और ज्यादा खाने का तरीका न मानते हुए ये भी समझना जरूरी है कि लाइफस्टाइल के अलावा जेनेटिक, एनवायरमेंटल और बहुत सारे ऐसे कारण होते हैं जिससे कि ओबेसिटी हो सकती है। तो ऐसा भी हो सकता है कि व्यक्ति कम ही खा रहा हो और वो प्रॉपर एक्सरसाइज भी कर रहा हो, तब भी वो वेट लूज ना कर पाए, क्योंकि ये इस डिसऑर्डर कॉल्ड एज ओबेसिटी के मल्टीपल कॉजेज हैं। इट्स अ वेरी मल्टीफैक्टोरियल डिजीज। तो ये फैमिली मेंबर्स को समझना है। इसका जो टैबू इससे एसोसिएटेड है उसको तो दूर करना है। तो इसके लिए सेंसिटिविटी ट्रेनिंग डॉक्टर्स की पहले जरूरी है, फिर फैमिली मेंबर्स की, और एज अ डिजीज ट्रीट करके when we say we have to act or it's time to act or everybody should act, what we mean basically is that we should seek care and opinion and proper medical treatment under very supervised team when we reach the BMI of 28. तो जब भी 28 BMI पर आप आ जाते हैं तो प्रॉपर ट्रीटमेंट, प्रॉपर केयर लेना बहुत जरूरी है, इवैल्यूएशन बहुत जरूरी है, और कोशिश करना है कि इसको उसी स्टेज पर रोका जाए और ये आगे ना बढ़े, क्योंकि जैसे आगे बढ़ेगा तो ये अपने साथ में डायबिटीज, हाइपरटेंशन और बाकी सब बीमारियां भी लेकर। There should be no stigma attached to obesity. First of all, it should be considered like a disease. The very moment that we consider it like a disease, we remove the stigma from it, because it should not be considered as a defect in trait or a defect in sort of doing that amount of hard work, or it should not be considered as a defect in an individual if he's obese, because we have to understand that it's not only a lack of physical activity or poor habits on eating, but it's genetics, it's hormonal, it's environmental, as I clearly mentioned, which is responsible for obesity and also type 2 diabetes. So first of all, consider it like a disease. Try and prevent it. I think prevention is the best cure here. Try and prevent it and modify the lifestyle. And as surgeons, as bariatric surgeons, as somebody who deal with this metabolic disorder, we should ourselves be very fit to put an example or lead by an example in front of our patients. My message for the World Obesity Day is that everybody needs to act. This action should come after an informed opinion about what this disease obesity is, how detrimental can be its effects on the body systems if it is not treated in time.